Dear participants, in continuation with my previous lecture, in this lecture I will be speaking more on the cancer chronotherapy. As we have seen that rest activity rhythm in cancer patients is abolished or the disrupted, and this rest activity rhythm is useful or it is used to determine the timing of the medication in cancer patients. So, particularly in cancer chronotherapy, that involves giving chemotherapy at specific times of the day or night, and this approach is based on delivering chemotherapy when cancer cells are more active and dividing. It means when the cancer cells are more actively dividing, so the chemotherapy may have more effect and that will suppress the cancer. So this particular picture, it explains the circadian rhythm in tolerance to various cancer medications. And in this chronotherapy, there are two approaches. One is the host rhythms chronotolerance, and then the tumor rhythms chrono-efficacy. That host rhythm chronotolerance means the host is they tolerate the medications, and tumor rhythms chrono-efficacy, it means effectiveness of the drug. And these are the various chemotherapeutic agents that have already shown their time-dependent efficacy. And this picture shows the least toxic dosing time, and it has been indicated as function of the rest activity cycle. If you look at this picture, as again there is a mice that is nocturnal in nature. So during daytime, here you can see that HALO hours after light onset they are inactive. So this is the rest phase, and this is the dark phase. When there is a dark phase, they are active. So we can see that, say for example, apirubicin, 5-fluorouracil, that is 5-FU, docetaxel, and these are the remaining drugs which are more effective during their rest span. It means if these drugs are given during the rest span of the mice, so then it will be better tolerated by the mice and the effectiveness is more. Similarly, other drugs, say for example doxorubicin, then cisplatin, oxaliplatin, carboplatin, then vinblastine. So these are the other drugs which are more effective during the active span of the mice. It means these drugs are better tolerated when mice are active, and at that particular time the chronotolerance is better and the effectiveness or chrono-efficacy of the drug is maximum. So these are all the chemotherapeutic drugs, and they have better tolerated as function of the rest activities response of the mice. And the same drug, in case of the human cancer patients, there are several clinical trials, and in the several clinical trials consisting of more than 2,000 patients, the effectiveness of drug has been established. We can see that in case of cancer patients, 5-FU and leucovorin at 4 a.m. they are maximum effective, and these drugs are better tolerated by the cancer patients at 4 a.m. Similarly, the oxaliplatin or platinum group, the chemotherapy drugs of the platinum group, they are better tolerated at 4 p.m. when the human subjects are active. So as we are 12 hours apart from the mice, our rest activity is 12 hours apart from the activity of the mice. So their activity span corresponds with our activity spans, only the difference is the time. So but here the phase is the similar. The drugs which are effective during the active span of the mice, it is again effective during the same time point of the day in case of the human cancer patients. So later on, again the Francis Levy group, they have established a relationship between the circadian time of best tolerance and the best efficacy for about 14 anti-cancer drugs in rodents. So the white panel that shows the rest span of the mice and dark panel shows the activity span of the mice. So we can see that these are the drugs which are better tolerated at the rest span, and the drug have the best efficacy during the rest span. However, the remaining drugs, they are very good tolerated during the active span of the mice, and the effectiveness of the drug is again maximum during the activity span of the mice. So the question arises, how the drug can be delivered in a rhythmic way. So now the multi-channel pumps are available to deliver the drug in a rhythmic fashion, and these multi-channel pumps, they are centralized programmable. They have the 3-week autonomy. It means after the programming, the drug can be delivered for 3 weeks. Any modulation of delivery rate is possible. 4 reservoirs consisting of drugs are available that can contain 100 to 2000 ml of the drugs. There are 2 independent channels, and the delivery rate of the drug that may vary from 1 to 3000 ml per hour. It is safe, and if there is some problem, so it has alarm, and it gives alarm so that if there is some problems, it can be sorted out. And in addition to that, this multi-channel pump, it also generates the report of the infusion rate. Here we can see that the multi-channel pump is programmed using the system computer, and there are 4 reservoirs in the middle panel of the picture. The 4 reservoirs, they are connected to the multi-channel pump after the programming, and these 4 reservoirs, finally they are attached to 2 channels, and these 2 channels are finally joined together in a tip, and it is connected with the needle, and this needle is inserted in the cancer patients for the delivery of the drug. And the most important thing about the multi-channel pump, that in that case cancer patient is not required to hospitalize for the treatment. It can be given in their ambulatory condition. So this is one illustrative example, and it has been established, and this regimen or this protocol is used for the treatment of the patients with metastatic colorectal cancer. Here 3 drugs are given in the combination: 5-FU, leucovorin and oxaliplatin. So here we can see that the 2 drugs, 5-FU and leucovorin, they start delivering in the body at 22 hours, and we can see that it is the delivery rate is in a rhythmic way, and the maximum delivery of these 2 drugs, 5-FU and leucovorin, is maximum at 4 a.m. in the morning, and thereafter it decreases and it stops delivering the body at 10 a.m. and at 10 a.m. the another drug, that is the oxaliplatin, it starts delivering in the body, and the maximum delivery occurs at 4 p.m. and then again it starts decreasing, and at 22 hours the delivery of this drug is stopped, and again then this 2 drugs, 5-FU and leucovorin, it starts delivering in the body. So this delivery rate or this rhythmic pattern of the delivery of the drugs, it continues for 4 to 5 days, and this infusion or this protocol is repeated every 2 to 3 weeks. So here, to maintain the energy level, 5% glucose is also given. So when the delivery rate is maximum of the drug, the delivery rate of the glucose is minimum. When both the drugs are minimum, so delivery of the glucose is maximum. So in that way, the delivery of the chemotherapy drugs are given in a rhythmic way. So then, what is the outcome of this chronotherapy? How it is better than the flat chemotherapy? So we can compare the outcome of these two chemotherapy protocol, and we know that the chemotherapy drugs, they are toxic in nature, and they produce several toxicity, and sometimes patients are hospitalized on account of the toxicity because of this chemotherapy drug. So if we look at this toxicity for hospitalization for toxicity, so we can see that 31% of the patients who were receiving flat therapy, they are hospitalized on account of the toxicity. However, in case of the chronotherapy, it is only 10%. Similarly, the two types of toxicity, that is the severe mucositis and the functional impairment, both are higher in case of the patients who received the flat chemotherapy, whereas this percentage is lower in case of the patients who were received chronotherapy. It means the toxicity is more in case of the flat chemotherapy as compared to the chronochemotherapy. If we look at the tumor response towards the drug, that is greater than 50% suppression of the tumor, so we can see that the patients who received the chronotherapy have better response, or the tumor suppression is more in case of the chronotherapy as compared to the flat therapy. So this outcome, it clearly gives information that chronotherapy is better than the flat therapy. If we look at this toxicity with respect to the chemotherapy cycles, so severe mucositis, here this is the example of the severe mucositis. So in case of the chronotherapy, up to 12 course number or the 12 chemotherapy cycle, this toxicity is very less as compared to the flat therapy. Here we can see that in case of the flat therapy, the toxicity is more as compared to the chronotherapy. In case of the sensory neuropathy, again we can see that up to 6 cycles, there were no difference between the flat and chronotherapy, but with the increment of the chemotherapy cycle, we can see that the toxicity is more in case of the flat therapy as compared to the chronotherapy. So again, this example exhibit that chronotherapy is better as compared to the flat therapy. Again, this is the protocol of the 5-FU leucovorin and oxaliplatin that was given to the patients of the metastatic colorectal cancer. So this is another protocol. If you increase the dose intensity, so whether they have the positive response or not. So in this first protocol, 3 chemotherapy drugs were used, 5-FU, leucovorin and oxaliplatin, and 3 regimens are given here. 1 flat therapy that is continued for 5 days, and every 16 days it was repeated. In the another protocol, chronotherapy was given for 5 days and it was repeated for 16 days, and here we can see that the dose intensity of 5-FU was increased. In the third protocol, which was given for 4 days and every 10 days it was repeated, again the 5-FU dose intensity was increased. And if you compare the objective response, so we find that the chronotherapy which was given for the 4 days and every 10 days it was repeated, the objective response was maximum, that means tumor suppression was maximum. So even if you increase the dose intensity, the response is better. In another protocol where only 5-FU and leucovorin was used, again there was dose intensity was increased, 5-FU dose intensity was increased and it was given for 4 days and every 10 days the protocol was repeated. So again we can see that the protocol that consists of 5 days and 16 days repetition, in that objective response was less. However, when it was with the high 5-FU dose intensity repeated for given for 4 days and repeated in 10 days, the objective response was better. So if objective response is better, then what it indicates? Indicates if the objective response is better, the median survival of the patient was higher. It means even with the high dose but if protocol is perfect, then survival of the cancer patient can be increased. So in another experiment, what does the timing of the administration of this drug was changed. This is the first protocol that we have seen in the previous slides, that oxaliplatin was delivered maximum at 16 hours, that is the 4 p.m. 5-FU leucovorin was delivered at 4 a.m. in the morning, and this is the FOLFOX2, that is the folinic acid, 5-FU, oxaliplatin and leucovorin, and it was given in the concentrate, that is the flat infusion of the chemotherapy drug. So this is the first protocol, this is the second protocol, and in the third protocol, scientists what they did, they shifted this chrono FLO4 by 12 hours. It means when it was the oxaliplatin which was given at 4 p.m. now it was delivered maximum at 4 a.m. in the morning. Leucovorin and 5-FU that were delivered 4 a.m. in the morning, now it was delivered at 4 p.m. in the evening. And this is the last one is the flat chemotherapy. So what was the outcome? By shifting the timing of the drug, what happened? So here you can see in the first schedule where the chemotherapy was maintained as the discussed earlier, that oxaliplatin at 4 p.m. and 5-FU leucovorin at 4 a.m. So this protocol, it decreases the incidence of mucosal toxicities 5-fold. That means this previous protocol is better tolerated and it decreases the toxicity. In addition to that, it halves the peripheral sensory neuropathy as compared to the constant rate infusion, as well as the chronomodulated administration with peak timing differing by 12 hours from the initial schedule. In the second protocol, where they shifted the timing of the delivery of the chemotherapy drugs by 12 hours. So again this 12 hour shifting is not good and this is not better tolerated by the patient. And in the first or initial protocol where the toxicity is less, it was also seen that this chemotherapy, the initial schedule was better tolerated and it achieved the best tumor shrinkage, that is the tumor suppression is better in the first initial schedule or the first schedule. We can see this is the first schedule where oxaliplatin was given at 16 and 5-FU and LV at 4 o'clock. So this is the time when oxaliplatin is better tolerated and it has maximum effectiveness. Similarly, 5-FU and leucovorin is better tolerated at 4 a.m. and the effectiveness is more. So it means all the chemotherapy drugs, they have the time dependent efficacy. So the time dependent efficacy of the radiation has also been established. The radiation therapy is also, if it is given with respect to time, then it has the positive effect. This is the example of the oral mucosa. So 0, it means when the tumor temperature is maximum and the radiation was given at that particular time as compared to the other, that is the -4, -8 means when the temperature is maximum, after 4 hours, after 10 hours radiation is given. +4 +8 means 4 hours before and 8 hours before radiation is given of the tumor when the tumor temperature is maximum. So then outcome indicates that if radiation is given at the highest temperature of the oral mucosa, so then it increases the disease-free survival by 2 hours in the follow-up study. In addition to that, it also decreases the tumor size as compared to the other time point. So decrement of the tumor size and the progression-free survival is more when the radiation is given at the peak tumor temperature. So this is very important findings in case of the radiation therapy. So there are some other researches that have established that morning radiation therapy tended to cause fewer severe oral mucositis, that is that it decreases the toxicity as compared to the afternoon radiotherapy in patients with the head and neck cancer. It means when radiation is given in the morning hours, so then toxicity is less. Similarly, if high dose boost of radiation is given, a single dose is given, so that it may be important for the eradication of the brain tumor if timing is considered. Similarly, morning gamma knife radiosurgery improved the rate of local tumor control by 50% and nearly doubled median survival as compared to afternoon gamma knife radiosurgery. This is another time-dependent effectiveness of the radiosurgery that give clearly indication that morning radiation is better than the afternoon radiation, that increases the median survival about 2 times. So this is another example of the chronotherapy, in that not only the chronotherapy, rest activity rhythm or the sleep-wake cycle is also considered. That these are the first left panel indicates the flat therapy and the right panel indicates the chronotherapy, and the patients were divided into 2 groups on the basis of their sleep complaint. The yellow indicates that there is no sleep complaint and red indicates there is a sleep complaint. So if you look at the flat chemotherapy, so this is the survival, and the authors, they didn't find any difference between the 2 groups in case of the flat therapy. It means the patients who have the sleep complaint or no sleep complaint, but the percent survival is the same in case of both the group. But in case of the chronotherapy, the patients who have better sleep, so there and was provided with the chronotherapy, so their percent survival is more as compared to the patients whose sleep is poor or they have the sleep complaint. It means chronotherapy as well as maintenance of their sleep-wake cycle is extremely important for increasing the percent survival of the patients. So on the basis of the number of research that is on the chronotherapy, these are some of the outcomes that Ravishankar et al. They concluded that 5-year survival time of the ovarian cancer patients can be increased if they are treated with the chronotherapy. Similarly, Levy et al. Group, they concluded that survival rate can be increased by 50% or more in mice or rat if it is given the chronotherapy. Similarly, the patients who received the chronotherapy, the objective response rate was increased by 66%. Then also Levy et al. Group also concluded that survival was increased by 18.5% who received the chronotherapy. So on the basis of the all outcome, we can conclude that this circadian-based chronotherapy is very advantageous, that it increases the tumor rhythm chrono efficacy, that is the effectiveness of the drug can be increased, as well as the host rhythm chronotolerance, that the tolerance of the host rhythm can be increased, and by increasing these 2 phenomena, the tumor burden will be decreased, and as the tumor burden will decrease, definitely the quality of life of cancer patient will increase, and that will increase the overall survival of the cancer patient. So in that way, we say that the chronotherapy is very good for improving the quality of life as well as the survival of the cancer patients. Nowadays, this chronotherapy concept is used for the for the treatment of the several diseases, as I told you previously, that asthma, arthritis, diabetes, sleep disorder, mood disorder, etc. So with this, I would like to stop, or I would like to conclude or stop my lecture. Thank you very much.